Hello, everybody, and welcome to Staffing Summit. Our first webinar today is titled How Tech Can Augment the Human Side of Care, Reshaping Technology's Impact on Critical Care Time and Patient Timeliness. I'm Joyce Famakinwa, a reporter at Home Healthcare News, and I'll be moderating today's webinar. Before we get started, I wanted to go through a few housekeeping notes. You will see a variety of boxes on your screen, which can be moved and resized to meet your preferences. Resources can be found in the resource box. We will have a Q&A at the end of the webinar, but please feel free to submit questions at any time during the discussion via the Q&A function. If you run into any technical issues during the webinar, first try refreshing your browser. And if that doesn't fix the issue, reach out through the Q&A box. I'd like to thank HHCN for sponsoring today's webinar. And now I'd like to introduce our panelists. We have Cindy Von Bank, who is the U.S. Director of RPM and Technology, who is the U.S. Director of RPM and Telehealth Technologies at HHCN. Cindy is an experienced sales executive and business development leader with more than 25 years of top-level performance in the healthcare industry. We have Kelly Karner, who is a registered nurse and the Vice President of Customer Solutions and Digital Strategy for Ikutan. Kelly is a seasoned healthcare professional with over 35 years of experience, including both clinical nursing and information services leadership. In her current role, Kelly helps home health and hospice providers across the U.S. leverage technology to improve patient care. And we have Stacy Brown, who is a registered nurse and consultant. Stacy is currently working as an independent consultant focused on helping both startups and established organizations integrate technology, develop machine learning models, and build quality RPM programs, and elevate technology solutions to enhance the quality of care and reduce costs. And with that, I will jump right into today's discussion. So thank you all for being here, first of all. I would like to start by asking Stacy a question. How have virtual visits and telehealth technologies specifically improved the depth and quality of patient-clinician interactions compared to traditional in-person visits? I think you may be muted, Stacy.
There, is that better?
Yes, thank you.
I think initially we were all a little hesitant, both from the clinical side and the patient side, around the introduction of technologies of any sort in our kind of clinical care delivery models. That obviously throughout COVID changed. We kind of shifted to it was a necessity, right? And it feels like today that patients and clinicians have really embraced technology across the board. We are now seeing that they can very specifically augment care delivery as opposed to it being what we initially thought would be really impersonal kind of touches. And so throughout the course of, I really have seen it over the last 4 years, we're seeing in like home care specifically, the leverage of technologies around platforms like RPM, virtual visits, hospital at home programs. We're really seeing that technology, that augmentation has not really introduced an impersonal interaction. What it's done is allowed us to elevate our care because we now know a lot more about the patients. Historically, those in-home visits were short, succinct visits that we had to apply some sort of specific skill to that required that touch. And today we can gain insights around how the patient's doing, what their actual health status is in a much more in-depth view because we're getting data from multiple types of apps, from RPM platforms, connected devices that are in the home. And it's just really added not only to the care delivery, but our understanding. And in 10 years, we're going to be able to look back on the data that we've collected and continue to change the way we deliver care around technology based on actual data that really is going to form, I think, an even bigger shift than COVID did on healthcare, because we're now going to have these reliable data sets. So I think that, you know, we've added RPM visits or touches, and we've increased virtual visits, and patients and clinicians now get to really have a choice around how they interact with the healthcare system.
I've also, from my perspective, when I'm watching this, as we've gone through COVID and how it's changed being able to incorporate these technologies, I'm seeing this increased level of trust from both patients and families that as healthcare providers, we're not just there in home health or in hospice when we walk in the door anymore, but that there is this increased level of trust that you're going to be there for me when I need you, however I need you. And that could be I call you and you come in person, and like it has been historically, which we still do, but it's also that, you know what, I don't need you to run somebody out to see me. I just need somebody to look at this pump. I just need somebody to help me talk me through what's going on. And I think that using technology has created that much more well-rounded feeling of I'm going to be taken care of no matter what ends up happening. And I think that's one of the really positive things that we've been taken out of being able to start using these digital technologies throughout COVID.
And that's a great point, Kelly. I think that trust is, I mean, we kind of all were, before technology, we're kind of forced to trust our providers, right? I mean, you either liked them or you didn't. And if you didn't like them, you went and found somebody else. And that's really become more and more difficult as the population has grown, aging population specifically has grown. And I think trust is an indicator of quality of care. You know, we so often we have metrics where we're measuring quality, and really, I think if you trust your provider or you trust the organization that is providing care to you and all of those people that interact throughout your care pathways, that is a sign of a very high quality impact from that specific organization or program. So very, very valid point there.
And I think another point to add to this is the impact on the skilled home health, in particular with virtual visits. We are seeing increased capacity of our clients that are using virtual visits to supplement when the nurse can't be in the home, almost double the nursing capacity or patient capacity, which allows home health to take more referrals, to grow that patient population without having to increase staff. We all know nursing shortage. Everybody's struggling sometimes to get enough nurses. So if we can really adopt technology, virtual visits, to get eyes on the patient, provide earlier intervention, high touch to those patients, proactive outreach with the virtual visits before the nurse gets to the home. So we're seeing really good impact from the client perspective as well.
That's such a good point, Cindy. And I remember in the early years of my nursing being the only person and not having that ability to have backup. And I think as we talk about our changing demographics of our actual caregivers, our nurses out in the field, that that ability to rely on each other, even in these remote settings, is a huge piece that digital technology brings that just wasn't an option years ago.
Right. And we all know reimbursement's declining while need is rising. Staffing shortages, are occurring. We have to get creative on how we solve those specific problems. And adding technology as a part of the kind of recipe for care delivery has allowed us to really have insights whenever, we've been so accustomed to seeing patients in four walls where we're both present, the provider and the patient. And today that's just, that's just not, it's just not a reality. We just can't continue to provide care that way. And so I think that, you know, looking at it from the perspective of how do we, especially the frontline worker, you know, the nurses, the physical therapists, those people that are out there, boots on the ground, delivering care outside of the four walls of a specific facility. Those are the people that we really have to figure out how we make their jobs and the ability to staff the populations they're caring for a lot more efficiently and a lot more effectively.
So I wanted to ask about, you know, data utilization. Kelly, I want to direct this at you. Can you share examples of how real-time data analytics have directly influenced operational efficiency and patient care timeliness?
Absolutely. And this is something that is emerging as we put all these technologies in place, and we're starting to see the data coming back at us. And what does that really mean in terms of real-time data? My favorite example of real-time data coming back is something that, I mean, I guess we could have had access to it for a long time, but all of the metrics that we can get out of modern telephony, we've kind of gotten used to just the telephone sitting in our office, and we use them. They are a tool. We, you know, oh, the phone's ringing again, but we know that it's patient care. Something happened when we went through our COVID, which is the hybridization, right? A lot of people had to shuffle home. We've got now these people who historically were in the office are now working at their houses, and the putting in the systems that allow to answer office phones in a hybrid situation where somebody is working at home, these newer, more modern systems, which existed before, but now in healthcare we're putting them in, have a huge amount of data that comes out of them. And I know that not all phone companies are the best at understanding what that data means in healthcare, but for those people who have been able to get those metrics and that data out, this is a huge game changer for our healthcare managers, especially in this home care situation. Because if you think about it, there used to be this idea of there was an office, everybody would come back to the office, you'd see what was going on, you'd take the temperature of, you know, this is how everybody's feeling. In today's world, our managers are often not only detached from that, they're managing remote and hybrid staff, and they really are being asked to stretch further and further in who they're covering. And so you don't even if you know your people, you don't necessarily have a chance to be checking in with all of them. And so these systems, when we put them in place and use them as part of a technology strategy to say, hey, how can I use these metrics that's coming out of the system that's supporting my staff to be able to know what really is going on? Where are our calls ending up getting stuck? Where are people not feeling care? How can I listen in and hear what's going on in these worlds? And it is so neat to me to see this data, because it's just data that comes, and some people have it and they don't even know how to use it. But for those who have really looked at getting that data in and saying, okay, what does this mean for my efficiency? Why are these people calling back 5 times in a day? What are my referral patterns that I can make out of this? Where are my inefficiencies? And there's just so much rich level of data in that. And that's just one example. That is just like a cloud-based telephony, modern phone system. We are seeing this in just about every tool. If we intentionally take a look at what that tool is, upgrading to something modern that gives us that data, like Stacy mentioned, like we've got data coming in now. How do we use that, and how do we use that intentionally? So my biggest example that I love to see, and I'm currently working with a bunch of clients saying, hey, let's get this upgraded. So if you're looking for telephony, contact me. But when we take a look at this and we say, okay, this is what this means and this is how this can help you, it becomes this big game changer for those people who implement it. And I am excited about that.
I think that, you know, there are so many examples of where data is being collected that we've been collecting for ages and it just hasn't gone anywhere. And I think with the you know, many of the clients that I work with, we talk through the data sets that they have access to and how we can take that data and make it actionable. And all data that is worth collecting, there should be some action to take on it. We just have to figure out what that action is, and then how we execute against it, and what the intended outcome is, and really close the loop on that by going back and seeing, did what we thought was going to come out of that data set actually, I mean, you know, were we right? Was our hypothesis correct? And really following through to make sure that we've consumed it and understand it and are now taking action against it and making it insightful. I talk to nurses all the time and physicians that say, you know, I hear about data all day long, every day. Everybody wants real-time data right now. And then we collect it, and then we don't ever really know what happens with it, or we don't really understand how it impacts our workflow. And so I think that we, you know, in healthcare, especially on the tech side, have to really push our data analytics teams, our intelligence teams to really close the loop back with those providers and show them how the data they're collecting can impact their care delivery. And I think that, you know, software platforms such as CareXM, for instance, does a really good job of showing us where that data can impact our workflow. And so we look at, you know, when you think about patient care timeliness, my biggest proponent, I think the largest benefit that you get out of like RPM in home health, for instance, is that insight into the patient's lives, their wellness, when they're not in the four walls seeing a provider, and then how we can get in front of exacerbations that typically they would have shown up at their provider's door. They would have gone in to see the physician and gotten their prescription and done all of those things that we know that the care system historically has you know, walked us through. To today, we may be able to prevent that physician's visit because we've gotten in front of that exacerbation and resolved it. And we've only been able to do that because of data. So they're not two disparate entities, patient care and data. We have to really start looking at them as a combined entity, that we have to have both in-person care and data along with virtual care to really be able to impact, you know, the overall healthcare system and create efficiencies across the board.
And before, did someone else want to jump in?
No, it's okay.
We're good.
Okay.
Such a great conversation, and we could just keep talking forever on it. There's so much data, and I think there was kind of this, as we implemented EMRs, we were always thinking, okay, our data is going to come out of this EMR, but the more and more data that the EMR wanted, the more and more pressure was put on the clinician to be entering that data. And we're finally getting to a space in our technologies where the data is being collected by something other than the clinician hand inputting it. And I think that is one of the most exciting places that we are. And we have to go there because we can't keep asking our in the field nurses and PTs, and we can't keep asking them to be nothing but a data input into this huge monstrous system that eats data and doesn't do anything with it.
Agree.
Before I ask my next question, I'd like to remind those who are tuning in that the Q&A option is available right now, so please submit questions. We will get to those at the end of the discussion today. So moving on, Stacy, What are some specific technological innovations that have been most effective in reducing the administrative burdens on healthcare providers, and how have they impacted the time spent on direct patient care?
So this really, Kelly's point prior to this question is kind of where I go whenever I think about those innovations. So I've been a nurse a really long time, and like before we had EHRs, I was a nurse, and they were considered a burden. And I would go as far as to say EHRs were really thought of on the patient care delivery side as a burden up until maybe the last year and a half, 2 years. I've started hearing, like nurses and physicians talk positively about EHRs and the data they're collecting. And it's largely because of the point Kelly made, in that it's not just being collected by a human anymore. It doesn't require me as a physician to have that interaction with the patient and be documenting in my EHR. And so it took a long time for that transition to occur, to go from an EHR being a burden to an EHR being an actual asset in healthcare. I think the same thing goes for RPM platforms and virtual visits. When they initially came out, not so much on the same level that they were a burden as we really thought about EHRs, but definitely in the sense that when you create streams of data and you're consuming information from a population, especially a population that's ill, there is burden created on somebody in the care team, because somebody has to follow up on that. And we really had to figure out how we were going to go about doing that. And I've been in the RPM space for a really long time, well before COVID and well before it was mainstream or trendy or anything else. And it was hard. It was really hard because, for instance, in home care, we would be collecting data on a population, and we would need some sort of interaction between the remote team and the home health team. And so you would reach out to the home care team, and it was kind of that, I've got to fit this patient in for a visit in my already overwhelming schedule. Over the course of the last 10 years, we figured out how to provide that, to augment that care and provide support to the home care boots on the ground team. But because we've added in things like video interactions, and patients have adopted that, and they don't feel like it's a burden, they feel like it's an asset today. Because if I go to my provider and I'm sick, I wake up today, I don't feel well, I go to the provider, I go through the motions, I go pick up my prescription, and I get home, it's 4 to 6 hours later before that has resolved. Today, I can do all of those things in a 30-minute virtual visit with my physician, in delivery from my local pharmacy in a lot of areas. And I can never leave my home and get the care that I need. And so it's created efficiencies in the system for sure. But most importantly, I think that it has provided improved access to patients and a better care delivery experience for them overall. I think that, we've really, the old system, and it's so funny to hear, you always hear your parents say in the old days, well, previously, the thought of going to the doctor was probably my most painful experience in any given situation. Like there's the waiting, and there's, so you want to make me get on the scale every time I come in to see you. I have a sinus infection. You don't need to know what I weigh for that. Those interactions just were painful. And today they've just gotten, if I don't feel well, then I go online, I schedule an appointment with my provider, and I see him, I spend 10 minutes on the phone, and there's a prescription waiting at my pharmacy.
Yeah, another point on that, reducing cost of care for the administrators, the home health care, the care teams, and easing that burden from the nurses. We want to use the nurses to the top of their license, right? Nurses are in it because they care for patients. So let's use the data. Why are patients calling? Why are vital signs out of range? They're out of meds. They're short on supplies. Let's not use our nurses for expensive nurses for that. Let's use our clinical teams where they really need to be in the home, taking care of that very acute patient, and then use non-clinical staff, right? Use the technology Why are these calls coming in? I'm not going to be here. They have a missed appointment. There's so many reasons that we can use technology to do proactive outreach, get more information from the patient without putting a burden on them. They can just respond via a text or a very simple yes or no questionnaire that can go back to a non-clinical staff member. So that costs a lot less for home health and hospice to have those staff members manage that data and then get the acute or pertinent data to the clinician, to the nurse, so they can make that clinical judgment and really provide the care they need. So we've seen a lot of decreased costs by using different staff members for different things. And the only way you can do that is through technology, getting the data, tying that data in, why are patients calling, and then using that to really help ease the burden across the care teams.
Carrie is so good about that with the amount of data that gets collected out of those calls. The other side that I see on that is not just the data that comes from the patient, but let's talk about the huge waste in healthcare, which is getting data from other providers. We still lose a ton of time in healthcare tracking down faxes, which I had so hoped by this point in my career we wouldn't be dealing with anymore, but we are still absolutely dealing with faxes. And that falls under this not quite so exciting topic in technology of what we call interoperability, which means the ability to get data from one system to another system in a way that is secure and usable. And we're starting to see a lot of encouraging moves in that direction. We're starting to see especially a lot of people who might be on like some of the newer platforms like an Epic or part of a system where they can log in and get things. There's a bunch of underlying interoperability, like around the care equality and the QHIN, like our direct messaging, that is really starting to connect these dots and get data from one place back into the place where our clinicians can get to it. And so when we talk about not just the time spent of the nurses in the field, but also the amount of time that we have spent for the administrative staff who have had to track down that information, that had to worry about and know that it was there to go get it in the first place. And this is a huge burden on our system and continues to be today. I see a lot of movement in our technology is making a lot of these things easier, and I really look forward to where this is going in the future. If you're looking at implementing any system, interoperability and that thought, especially of like, okay, how does this data get to the right place that we know that it needs to get used? And that is one of the most important keys to technology.
So true.
And Stacy, I want to hear from you again about this. How do platforms balance the reduction of operational costs with the provision of high quality care? What metrics or outcomes do you use to measure success in this area?
So when we sit down and talk with potential partners about a platform, specifically if we're looking at an RPM platform to help just supplement care, and that's the key to it. We're not trying to replace nurses. We will never do that. Cindy mentioned talking, like leveraging clinical teams to the top of their license. That has to be a discussion out of the gate whenever you talk about any sort of technology play. We have to identify who the care team is made up of, what tasks that they should be doing versus what tasks they are doing, and how do we really pull them out of the mundane day-to-day work that they've added on typically because of cost. What technology solutions, regardless of the industry, can we put in place to help, really elevate that clinician to do not only the things that they're licensed and they're trained to do, but the part of the job that they love to do. Because if we're doing what we love every day, and as cheesy as probably my children would say, if you're doing what you love, it's not a job. And I love nursing. What I hate about nursing is all of the things that you want me to do because there's nobody else to do them, and it's inefficient and it's a waste of my time, and it doesn't benefit or improve the quality of care that my patient's receiving. So how do we plug technology plays in to really elevate the clinical teams? You know, you can ask a physician what they love about their job, and they'll tell you, I used to love being able to interact with my patients because that's what I spent most of my day doing. Today, they would tell you, I spend 3 to 4 hours with patients, and I spend 6 to 7 hours a day documenting on what I did with those patients or signing off on orders and all of those things. And EHRs have made that a lot simpler for them now that we've shifted to them being an asset. But at the end of the day, I think we really have to figure out how to leverage technology to do the things that technology can do. And then as far as really evaluating that, listen to the voice of your team. So internal customer service is a term that that I had somebody that was in marketing say to me a number of years ago. And a marketer that I really respected, she was also a clinician, and she said, you know, that often we forget about the internal customer service that we have to deliver to our internal organization, and what makes your clinical teams happy, what really, because if they're happy, their care delivery is automatically going to elevate. Outcomes are automatically going to elevate. And there are lots of more technical things that we could discuss around, like the specific metrics and KPIs that we would really measure against. That's going to vary by setting. In home care, we want to see reduced hospitalizations, reduced readmissions, improved overall quality outcomes and patient satisfaction. But you really need to look inward at your internal teams and figure out what are the things within their day-to-day workflow that we can extract and place that burden on some technology platform and let them get back to doing what they love to do.
And Kelly, in what ways has technology contributed to reducing clinician burnout, and what feedback have you received from staff regarding these changes?
Well, and I think Stacy just touched on a lot of this. Clinician burnout is very real, and it's making an entire impact on our industry, and we know it. I mean, this is something that I don't know a single manager that's not dealing with this. And so when I hear this, oh, we're going to solve clinician burnout with technology, it makes me nervous, because clinician burnout is not a technology problem. It's an overall problem. And really looking at the reasons why our clinicians are getting burnt out is one of those really important things that we have to understand before we can understand how to use technology in order to help it. As Stacy points out perfectly, there is one of those issues is that we're asking them to do this data collection and documentation, and they're not getting that time with their patient. So they're not being utilized. They're not feeling valued. But then we've also thrown them into these systems where they're constantly caring for other people. And especially as we went through COVID, their needs are almost always secondary. And so when you have a person who has dedicated their life to helping others and caring for others, and they find themselves in a position where their needs are not being met, they are not being asked, what can we do to make you happier, healthier? How can we make your priorities also our priorities? This becomes a big problem. And so this is really where when we look at technology, you can take one technology that has solved burnout issues in one environment, and when you throw it in another environment, it adds to burnout. And that's because when you are going through change management, when you're solutioning, when you're trying to figure out what the right solution is for the burnout problems that you're having, you really need to look at what is it that our clinicians, our providers, our in-home caregivers are complaining about? What is it that's making them feel like they're not being taken care of? What jobs are making them feel like they are not being allowed to work to the height of theirs? And if every technology solution is always based on this bottom line of can we make more money out of it, we're never looking at, hey, can we make somebody's life easier out of this? And so part of it starts with, it's like part of a balanced breakfast. Fruit Loops can be part of a balanced breakfast if you look at that overall, what is going into it. Technology can be part of a balanced strategy if you're actually looking at that strategy of the overall that's going into it. So some technologies, depending on your clinicians and providers' source of burnout, can be these things that are like our data collection, right? Bringing the data in that they're not the ones having to enter it so that they can focus on just treating that rather than entering vital signs, right? The other sources of clinician, helping with clinician burnout, as we're talking about, were these administrative, getting data point A to point B, so they're not having to go look, that it's right there for them, that we're automating certain things. I did see one of the questions that pops through, though, as I'm watching the questions come in, was talking about, as we look at automating these systems, especially around AI, are we automating the right things? Because there is such a concern about and a rightful concern about the bias that can happen with how we program and use our data. And so are we automating the smart things so that we have the right time and place to automate it appropriately without causing more harm? And so looking at clinician burnout starts with, what is it that your clinicians are burned out about in your environment? Because I've seen environments where technology, they are resilient, they want it, they bring it on. You get that technology to our situation, we're going to figure out how to do it. And then I've seen other places when they're like, oh my God, I cannot take another system, like don't even change my buttons in my email, I cannot deal with this. And so you have very different groups, and you need to know what kind of a group you're managing and what their needs are to even start with a conversation of what technology is going to help me with my clinician burnout.
Yeah, and I think just to wrap up this final point is there's so much technology, right? There's technology confusion, teleconfusion. What is telehealth? What's RPM? What's virtual? What's triage, non-clinical, clinical? So I think it's important to, again, be prescriptive about your first pain point. What are you trying to solve? And then working with experts in the industry like Stacy, like Kelly, that can sit down with your team and that have a lot of experience in years using these different types of technologies to help start with one place, right? You've got to start somewhere. But again, when you're as an organization, it's everybody's saying different things. There's so many types of technologies. So what's going to be best for your organization? And it's starting with some experts that can provide some guidance to help you, pick a program and find technology that's going to be sustainable, cost effective. That's important too, right? A lot of technologies are overpriced too, and your cost out of the market, right? But there's a lot of good technologies out there. So that's just a little advice wrapping up this question.
And Stacey, can you discuss how increased technological touch points have improved patient outcomes? Are there particular technologies that have been pivotal in this improvement?
I think, just continuing on in like the home care space, for instance, the primary goal outside of, improved quality and patient satisfaction is really the reduction of cost overall. So how do we have to, when we look at technology and we look at adding in anything to a workflow, we have to evaluate the cost of the actual technology. But we should also, what is the offset of that in other areas of cost? And so specifically for like RPM, adding in remote patient monitoring where we have devices in the home alongside where we're capturing biometric data, we're capturing symptom data, along with virtual visits where we're having touch points between real in-person visits that are occurring. There are costs that we drive out by leveraging this technology. And we do that through things like reduced ER visits, decreased length of stay when they do need an inpatient hospitalization. But there are and those are the obvious ones, right? But there's also the decrease on the patient side in co-pays, in prescriptions, because if we get ahead of an actual issue, if you have a home care patient that is sick, that they're having an exacerbation of their heart failure, if they go into the hospital, they're going to have a significant copay. They're going to have cost burden on them. We can pull that out from their individual budget. We pull it out from the insurer's budget, right? Because our cost, because it didn't occur. I think that the other thing that we see that we're not really able to keep a tally on and drive out the cost is, what are the other things that occur for that particular patient or that particular organization when an event like a hospitalization happens? So in home care, you've got to go out, you've got to do a follow-up visit because this hospital event happened. It's a time point that requires a specific visit type. That's additional cost on the home care agency. We can avoid that because that visit's much longer. It's more costly to the agency. And while we may not have avoided an entire visit, the entire visit, we've definitely changed the level of that visit, the intensity of that visit, which has a cost reduction attached to it. So there are lots of other areas where we get return on investment in platforms. And then there is the sheer issue of staffing shortages, and we're having to pay clinicians more for, and we all want to be paid more, right? I don't want to sound like I'm advocating for paying clinicians less, but if we're going to have to pay them more because the market has put us in a position that that's a requirement, then we need to be getting the most out of those clinicians that we can, and we have to do that with technology. And I think that, I'm a huge advocate of remote patient monitoring in the home care space, but also just across care spaces. I would love for, for my provider to engage with all the biometric readings that I know that he sees. He doesn't necessarily have time for that. And so having a team that is managing that, that's giving advice, even from a wellness perspective, not necessarily even when you think about your sick patients and those interactions, but also from a wellness perspective. Let's push off, let's get patients engaged through technology in their healthcare, and let's push those chronic illnesses down the road a bit for them so that their quality of life is a longer period of time, and they really get the benefit of that.
Great points. I also think the high touch to patients, right? Patients have become very familiar with virtual visits technologies, and the pandemic really changed all that. It forced providers and patients to use virtual technology, and our elderly patients have really adapted well. They like using that smartphone, right? They don't have to clean the house and get dressed for somebody to come over. They can do a quick visit, and they really interact well with it. And then you're getting those touch points, the proactive outreach to your patients during the week, just a warm check-in. How you doing? Do you need anything from us? And that's going to return much better satisfaction scores. You're not bothering them, but you're letting them know you're there for their care. And the same thing for tuck-ins, right? On a Thursday, you want to use technology to proactively outreach. Hey, do you have all the medications you need before the weekend? Do you need anything from us? And hopefully that lowers those calls that come in on the weekend that a patient's panic because they're out of supplies or they're out of meds or their pain is intolerable, right? And then they've got to go to the ER. So the check-ins and tuck-ins that are non-invasive to the patient, very easy to use technologies, and they're really cost-effective. It's very inexpensive to do virtual visits and use that patient engagement technology, very inexpensive. And that's always a good place to start, to have that patient engagement and build that relationship with them. So when they need service again, they're going to think of you and come back to your organization.
We're seeing this as well in the real-time feedback, which is around not just patients, but family and caregiver feedback, the product that Equiton offers, which is akin to a survey, which of course there's so many regulations around what we can ask, especially in the hospice, but in the home health world as well. What can we ask? But being able to give a voice and that ability to reach out like a rounding, like a manager walking around and checking in a restaurant saying, how is everything going? Or house supervisor wandering and checking with patients and family members, that we find oftentimes families will give us a perspective that the patient doesn't, and it's not part of the ado of a in-person visit where everybody is keyed in and watching, and it's an event where it's just like, yeah, this is still going on. Did you know that? And so really being able to get that larger picture when it's not the big ado of a home visit where they're welcoming somebody into their house.
And Cindy, looking ahead, what emerging technologies do you see as being particularly promising for enhancing the timeliness and effectiveness of home health care?
I think the future is really bright. I think the technology companies, the cost has come down. We have better technologies that are easier to use for the clinician and the patients. Both of those factors, if the nurse take out a big clunky device and they don't want to do that, if it's too difficult for the nurse or the care team to use, or the patient, the program isn't going to work. So you've got to have smart technologies, looking to the future, again, cost effective, and looking to wearable sensors, right? Wearable technologies, much lower cost. You don't have to put a lot of equipment or expense in the home. Using the technologies that are coming out, continuous glucose monitoring to get those data points, more data in. Analytics, certainly, in those technologies to pull out those data points for your organization. Different types of sensors, better, cheaper technologies that you can use in the home and not have to have a lot of expensive technologies.
I cannot agree more. I think that we are all so connected, and we are capturing health-related data on ourselves, and it's living in our own apps or in, Apple Health or Google, and we just aren't leveraging that on an individual basis. We're not seeing that being leveraged. And I think that, the devices and the device companies, that's, CareXM's offering, for instance, all of the RPM platforms out there, it's not about the blood pressure cuff. It's about the platform that's taking in all of the data and really presenting that data back to an individual or a care team that is meaningful. And there's so much going on. I test all kinds of devices for various organizations, from sleep devices to fitness devices to blood pressure cuffs. And at the end of the day, there's nothing really special about the device. What's really special is the platform that is collecting that data and how it's being presented back out. And we just have to continue to really iterate on the platforms and how they consume that data and present it back to us as consumers and to our patients.
And using those technologies real quick on different types of populations. You see a lot of technology, but they're only specific to maybe a home health care patient or behavioral health. But to really work with your enterprise systems, your hospitals, your ACOs, you've got to have technology that can adapt to the certain patient populations, from maternal high-risk pregnancies to behavioral health, video chats, pediatrics, and then of course that elderly population and chronic care management health plans. So you've got to look for technologies that can really support all those populations and not just one in particular. And I think that'll help you go a long way with marketing yourself out to your communities, your health systems, your ACOs, to partner with them and show them that you're doing something different than everybody else in your space.
I think one of the most important things that we're seeing in our technology is this use of the buzzword AI, where AI, artificial intelligence, and the multitudes, because not all AI is exactly the same, but what AI really allows us to do that we have never been able to do before is that ability to process large amounts of data. So if we're talking about just getting this incoming feed of all of these biometrics, that if we can take and have something that is looking through that and has been trained to be able to say, hey, this is different, this is important, this is what needs to be looked at, and put the right information in front of the right clinician or the right discipline to make sure that the people who are giving us their data, that we're being good stewards of it, and that we are activating the care team appropriately with data. And this is where AI is this huge piece that's coming in and really being able to take us from this information overload age of all of these data streams coming in and giving more for the clinician to have to do and look at, to be able to have all of this information coming in and being able to turn around and activate the right people through things like intelligent routing and notifications and real-time alerts. And these, we are just in the infancy of this. There is a lot of systems that are starting to do this. We're seeing this come up. Absolutely, there are concerns with cybersecurity, number one, and being able to, how are we getting this data in, and is it secure, and are we using some microservice that is selling our data to Google? Like, these are all of these things that make it where other industries have been able to jump on this and just do it. We're seeing in our environment that we've had some real problems, and some people are facing some pretty big fines from not even knowing what was going on. So there's kind of like, we're inching our way into this, but over the next few years, I see this is a piece that's really going to be taken off as we get a good handle and say, okay, we know we can't do that. We know we can do this. We know that we don't have the right data, or that the data that we have to build this model is biased, but we know how to correct for biases in our system. Like, these are all issues that have to be watched. We have to have domain experts in healthcare to be able to take a look at this and make sure that we are not furthering biases that already exist, but that we can take and put it into a context that helps our clinicians, rather than burying them in data, that we're helping them to really take that in and give better patient care with it.
So, all right, I would like to thank our speakers today for their time and their insights. You know, for those of you watching today, please remember that you can submit questions via the Q&A box. And with that reminder, let's dive into some audience questions. So we had a lot of questions come in through the chat. So you guys are very eager to speak to our panelists. In order to get to as many as possible, maybe we can have one panelist weigh in per question. So the first question from the audience is, can you share more about the exciting tech advancements that are reducing the administrative burden on clinicians around charting and data entry?
I mean, I just from my experience, what I think we're seeing the most is, you know, really being the advances in natural language processing and the ability for clinicians. You know, that's historically been physicians dictating into their phone and some service transcribing that. I think that's where we're going to see a lot of advancements with AI. I think that we can, there are those systems for NLP are really gaining a lot of traction, and they're embedded in EHRs today. We're going to see those embedded, I think, in other areas, so that we can not just capture the actual words spoken and the dictation or documentation that the clinician's providing, but also the inflection of, you know, what they're saying and how they're saying it. And that also goes for patients, you know, them being able to report symptoms and that sort of thing. I think that's really where we're going to see a lot of advancement.
How do you see technology being used in hospice?
I can probably take that question. Technology, hospice has been more resistant to do virtual visits. That it's such a more difficult environment, right? That nurse wants to be there holding that hand with the family members. But what we're seeing now is using technology, little call buttons. So revocations, right, can be an issue with hospice. So using technology in the home, so the patient, caregiver, family member feel connected to that care team where they can push a button and it'll go directly to the care team or the triage nurses to get instant communication. So we see that has made a big impact with hospice in particular, not calling 911 and going to the hospital, setting those expectations and educating the family members using technology. Also the tuck-ins, those warm touch points with the family members, it goes a long way, right? These caregivers, they're in distress. It's a very difficult time. So if we can do that proactive outreach to them, how you doing today? Do you need anything from us? Using very low cost technology. How was your nurse visit today? They can rate that. You don't have to do a full questionnaire. We have to be careful around those things, but just to ask how the visit was. Is there anything else we can do? We've got a hospice organization in particular, the CEO. She actually recorded a nice little video with her personal number. We're here to help with anything you need. And they push that down to the family member or caregiver via their smartphone. Again, virtually no cost to that. And it really sets the tone for those hospice organizations to say, hey, I'm here to help you. You're not just another patient or number to us. So really good traction in hospice now.
Someone wanted to know, what is the current state of regulations and reimbursement for RPM and telehealth and home health?
Stacey, you want to take that?
That's such a fun question. So from a regulatory perspective, I think we've seen some new codes in the last couple of years that are not just specific to RPM, but something called remote therapeutic monitoring that are out there. So we're getting some traction in CMS recognizing that the services that we're providing are worthy of reimbursement. And so that, of course, has really kind of ignited the flame of organizations to go out and explore what RPM reimbursement can do for their particular organization. I think we have to really lean hard on organizations like CareXM and other RPM platforms to really get their costs down to where it's affordable and the reimbursement can match the cost of the program. Because even if it is a net neutral return on investment, you still are getting improved quality, and you're assisting burnout across your teams, and you're augmenting the delivery and the way that we provide care in a positive manner. Those are things that are attributes. And I think today we still struggle to have an ROI that resonates with the decision makers in organizations. And so we have to get really creative in that perspective. I keep a close eye out on the regulatory perspective. I think the FDA, while we need them and they are a huge part of the healthcare system in the United States, they're a very difficult organization to navigate, and they do put up roadblocks. So we have to continue to learn and really engage with the FDA to get out of the way of ourselves. And AI is going to be, that's a whole, we could have a 10-hour conversation on how AI is going to impact it. But reimbursement is improving. The way we get reimbursed is improving. Regulations are not as strict because of COVID, I believe. Really COVID kind of pushed RPM ahead about 5 years from an adoption perspective because of the immediate need.
And we're almost at time, so I'm going to ask one last question. Someone wanted to know, did you need to customize your EHR to get your RPM data broken down to just the information you see as needed?
I can tell you my experience with that. Most EHRs have an interface with that the RPM platform can an API that they can interface with. So from the back-end technology perspective, it is there. There are also companies out there that kind of play as a third party. I think of it as like the landing strip. So the plane flies in, it has to have somewhere to go. It can't just be at the gate when it lands. And so there are platforms out there that can be that landing strip, and then the handoff to the gate agent to really consume the data into the EHR. It's much better today, but we have not done as good of a job in the US as a lot of other countries. I work with a lot of global companies that they've done a better job at this, but we really have to figure out how we get that data over there and how it displays across so many different touch points, because we don't have a standard EHR. So we definitely have challenges there still.
All right, that is all we have time for today. I'd like to thank everyone for your questions. Any questions that we didn't get to will be followed up via email. If you enjoyed this webinar and want to share it, as a reminder, this webinar will be available on demand through the webinar link once the event ends. And thanks again to CareXM for sponsoring this webinar. And thank you for attending. We hope to see you at another home health care news webinar soon.